7 minutes past 7 then. We'll start this hour with an update on a big story that we've covered many times in the past few years. The changes coming to the way that healthcare is delivered here in Dorset. Now, we've told you that campaigners have launched a judicial review and they are now crowdfunding for the cost of that case, going to the public and asking them to help them to pay for it. We've also spoken to the claimant who's at the centre of these campaigners' case. Tristan Pascoe, our Dorset political reporter, is across this story and joins me with details. Tristan, good morning.
Morning, Steve.
Just always worth, I think, explaining the context of this, these big plans which would change how the NHS serves you, our listeners in the county.
Well, let's be honest, for Dorset residents, it's the biggest reorganisation of healthcare in a generation. Last year, the CCG, the Clinical Commissioning Group in the county, approved changes which would see Bournemouth become the main A&E hospital for the east of the county, make Poole a specialist unit for planned procedures, the idea to prevent more than 100,000 people getting treatment in somewhere other than a hospital. But the plans overall are financially driven, hoping to plug a projected shortfall of 158 million by the year 2021. They have proved highly controversial, as you know, from the campaigns, protest marches, demonstrations that we've talked about many times on the programme, Steve.
Yes, so there's a judicial review which these campaigners against these changes have launched, and they are now crowdfunding to, bankroll that?
They're trying to raise money and hoping that some of the many hundreds of people who've signed petitions, for example, will contribute to this cause. We reported on Friday that the Defend Dorset NHS group have launched this crowdfunding campaign. They say it claims there are big concerns for them around unsafe travel times, the closure of community and acute hospital beds, and what they described as a misleading consultation in the run-up to the changes being approved. In fact, on the day of our broadcast, you remember earlier this month from Bournemouth and Poole hospitals, 2 weeks ago, the group were told that the claimant had been granted legal aid, which actually reduces the money they'll need to raise, but they do need to find £5,000 in addition to take it to the next stage of the process, and then a further £1,000 if granted a full hearing. It's not a huge sum of money in the grand scheme of things. I beg your pardon, that's a further £10,000 if granted. But it's a sort of drop in the ocean compared to the amount that hospitals are actually trying to save. But for anyone trying to bring a campaign like this, it's a considerable sum, yeah.
And we have now heard from the claimant at the centre of this judicial review.
Yes, she wants to remain anonymous. She has an acute condition, which we'll talk about in a moment. We'll call her Anna from Purbeck, and at this stage she doesn't want any identification details given. Stress can exacerbate her illness and cause actually a rapid deterioration in her condition. She was admitted 8 times last year for 3 days or more with an adrenal crisis. This is because she has what's called secondary Addison's disease, a rare disorder of the adrenal glands. These sit on top of the kidneys and produce 2 essential hormones in the body, cortisol and aldosterone. More than 8,000 people in the UK have this condition. It can affect people of any age. The symptoms include fatigue, lack of energy, motivation, muscle weakness, low mood, loss of appetite and increased thirst. Now, with treatment, symptoms can largely be controlled. Most people with the condition live a normal lifespan and are able to live an active life with few limitations. But people with Addison's disease must be constantly aware of the risk of a sudden worsening of symptoms, an adrenal crisis. It is a medical emergency which, if left untreated, can be fatal, which perhaps explains some of the concerns about the changes that are planned for healthcare in the county. Now, we've asked someone else to voice up a short bit of testimony which Anna has sent us about the last time she was admitted to hospital on New Year's Day.
I've never seen Poole so busy. At one point, a member of staff told me there were at least 6 ambulances waiting to hand over patients. I was told it had been that way for days. My 10-hour wait was because there were no suitable beds available. All the staff were working incredibly hard, but it was clear that the hospital was at full capacity. There was a clear pressure on staff to discharge patients as early as possible. I can't fault the treatment I received. The staff were kind and attentive, but it was clear that everyone was feeling the strain, which is why these cuts worry me. With proposals to downsize the emergency facilities and cut the number of acute beds across the county when clearly they're so needed. It was very frustrating to watch.
Well, that's a lady we're calling Anna from Purbeck, who's the claimant at the centre of this judicial review. Tristan, what next now?
Well, clearly the campaigners say they need to raise the money to progress their application. The Defend Dorset NHS group have got 5,000 followers on its Facebook page, and it's from there which they're sharing the crowdfunding appeal. As for the CCG, which of course are behind these changes, it's told us we are aware of the campaign and will respond through the appropriate channels. It's one we shall return to, Steve, many times, I'm sure, in the coming weeks and months.
Tristan, thank you. Tristan Pascoe, our Dorset political reporter.